Well, good evening. I'm delighted to be here. I've been told I should walk up and down and not stand behind there. That is what a TED Talk means. So I'll try and do that. Of course, it's very special to be talking after Mariana. You always sort of feel you can't top this Italian style, of bringing across the issues. And it's really been fascinating to work together with her over the last 2 years, and we were able to present the report at the World Health Assembly. And as she indicated, we have a number of plans how to take this kind of thinking forward. I was thinking a lot, what should I actually call this talk? And the best thing would have been to call it Everything, Everywhere, All at Once. Because that's really what's happening in global health in this very decisive year just now. And at the same time, it expresses what Mariana also said. All these processes are not really coordinated, and they don't all work to one mission. And actually, it was very interesting for us when we started working on the council and had a discussion with Dr. Tedros what that council should be called. It was actually a rediscovery of the term health for all. Many of you are probably too young to think back to Halfdan Mahler when he introduced that in 1978. But that was the basic idea that we have been missing over the last at least 10 years in global health, that our mission is driven by health for all, that means by equity. And one of the things we are experiencing right now is that that is coming back to bite us. Because we have not focused on equity, we have not focused on the poorest, we have not focused on the most vulnerable. And we experienced that during the COVID-19, and I will come back to that. Now, if we had a mission, we would probably say, here are all these negotiation processes, and if you're in global health, a negotiator, you'd probably be in at least 10 of them. And many countries are complaining, many negotiators are exhausted. Christoph and I were in Goa at the G20 and talking to some of the representatives there. They said, I just can't think of, going to Hyderabad in 3 weeks and doing this in between. And it also means, quite literally, that you have an overburdened and exhausted group of people trying to take all these negotiations forward and trying to act responsibly. But the first question would be, do all these processes strengthen global health, or do they actually contribute to increasing fragmentation? And that fear of fragmentation is continuously there, because every such process, to some extent, has an owner, particularly if they're political processes like G7 and G20. And you heard from the minister how proud he was. Germany did this, Germany did that. So every country, and again, we experience this in Goa, as it is pushing and developing one of these processes, of course, wants something to show for it. And what's the best thing to show? Another fund, another institution, another process, another something. And I think this is something we have to look at very critically. That doesn't mean every single new thing that is created is wrong. That's not what I'm trying to say. But there is this inflation of processes that lead to an inflation of outcomes that we don't know how sustainable they are going to be. And politically, the danger is they encourage regime shifting. So if you're in one kind of context, let's say, like WHO, with over 190 member states, you might not get what you want. So off you go, and you try another forum. And you try and use that forum to, again, have a resolution, a declaration, or something that in turn will where you're not getting what you want. And actually at present, particularly between Geneva and New York, we're experiencing this encouragement of regime shifting quite considerably. But at the same time, something much deeper is going on, beyond also what Mariana referred to. And a number of people have been opening the discussion on that. Is global health, even though we all love being called global health, is global health still the concept that we can and want to uphold? Is that what expresses the challenge we are trying to address? And what does it mean in the present geopolitical development? People from the global south are telling us, global health is a concept from the north, we don't want it, thank you. What does it mean in terms of scientific breakthroughs, of all the things that are interrelated? What does it mean in terms of the major inequities that Mariana has also made reference to, of a world divided? And again, I come back, what is this common mission? And it seems less and less, and I come back to health for all, and actually interpret the all much broader than we used to, that this is not about human health alone anymore. And there is this question, which is the concept that we're working with? Is it human health? Is it one health? Is it planetary health? What is it? And I think we have to give some very deep thought to that as well. But what really is the global health challenge? And that has really come to the fore in terms of many of the negotiations that are underway right now. And you can see how the issue of the for all, of the equity, and of the broader multi-sectoral dimension is actually driving all negotiations that are going on. And you can see the voice from the south, Yodi Alakija, who said very clearly what went wrong with COVID-19. What went wrong was power and greed. And if you think, well, yeah, that's what people in the global south will say, I thought, I'd give you the quote of a former colleague at Yale, Gus Speth, who founded the World Resources Institute. And I love this quote. He says, I thought the key environmental problems were biodiversity loss, ecosystems collapse, and climate change. I was wrong. The top environmental problems, and you can insert global health problems if you want, are selfishness, greed, and I think the worst of all, apathy. And that, of course, is what many of us in global health are feeling. We've had a pandemic. Would somebody please do something about it? And so we were actually optimistic at one stage, Global Preparedness Monitoring Board. We said, finally they're all going to wake up, and we've all these fantastic recommendations, and finally something's going to happen in all these countries and at the UN and you name it. And well, we're not quite there yet. We're also not there because something else is happening at the same time. We are in a big period of geopolitical upheaval. The world is changing. And I think that is something we all are feeling. I can't go through all these points here, but we are seeing that this multipolar world, that the North-South divide, that many of the conflicts that we are experiencing are also impacting global health. Anyone who was at the World Health Assembly saw geopolitics at play. And suddenly we were having blind voting again, secret votes, secret ballots for the very geopolitical reasons that some countries didn't want to show what they were actually voting for in relation to the Russia-Ukraine conflict, for example. And I think we're going to see much more of that type of voting. We've also seen that the whole system is becoming in terms of the alliances that countries have, much more transactional. There is very little common good in the global health discussion, and Mariana also alluded to it. And there's at least two areas that are becoming more and more important. Economics in a whole range of ways, with supply chains, with new types of investments, etc., with, and I'll come back to that, particularly debt relief, and of course the increasing role of science and technology. Mariana also alluded to the digital divide, but the competition between countries, and health is right in the middle of that, of the scientific development of vaccines, medicines, bioengineering, everything here, and all the digital development, artificial intelligence there. And competition is going on. So the power dynamics are at the heart of all global health diplomacy, and what we're seeing in security, I hope this is not me, but the technology, we see that in the past, and what we work with right now, is in global health, the regimes that we have been tailored to the hegemons. Okay. Have been tailored to the hegemons. So big countries, big capital, big donors, big philanthropies, and this is exactly what is being challenged right now. And we don't have in place yet what is to replace it. And that's where one of the big tensions is. Also a big tension if you look at the decision of WHO, of its member states, to embark on a new investment process, for example. If you don't want the classical replenishment of the Global Fund and others, what is it that you can put in its place? Will you be able to convince India, China, and some of those others to put in the same amount of money that some other big donors have? So I think we're going to see these power dynamics shift and change. And of course, they are also shifting and changing in relation to ideologies and ways of looking at the world. And one thing we had never thought would happen, why are there no Council conclusions yet in relation to the European Union Global Health Strategy? Because the strategy speaks up for sexual and reproductive health and rights. And there is a country in the European Union that feels this policy is too gendered. So these are the kind of things that are happening now in global health. You've heard about the WHO processes. I don't need to say that much about it. The treaty negotiations, the working group provisions, the treaty negotiations are going on as we are here. But one thing is clear, we need a success there. We heard the minister say, you know, WHO was successful in the context of the COVID crises. The worst thing that could happen to us if we don't have a success with the treaty. On the other hand, we have, you know, very big issues that need to be resolved. And again, it's particularly the for all issue, the access, the kind of things also Mariana talked about. But if we look at the other processes, of course, we have G7 and G20. Interestingly enough, that the India G20 more oriented towards the WHO, the Japan G7 more oriented towards the processes in New York, for example, around universal health coverage. And many of these G20 presidencies, I put the first one on health up there with Angela Merkel, to say that, you know, when first health was introduced to the G20, nobody thought that a G20 country would be organizing around 3 to 5 health meetings per presidency and pushing agendas forward in this way. But even more important, and that will have impact on the health negotiations, is that in a row we're going to have 4 key swing countries, as they're called in geopolitics, responsible for the G20. We had Indonesia, we have India, followed by Brazil, followed by South Africa. And a whole group of them are also organized in the IPSA and in the BRICS. And they're just discussing to move the BRICS from South Africa to China so that Russia can attend. So you can see there is, a totally new sort of power balance that is emerging here, and that's going to drive the health agenda in a totally new way, and we have to be very, very aware of that. We also have a number of negotiations on financing. If you ask me, the most important health finance negotiation would be a response to the debt crisis. And you can see here the link between debt and climate vulnerability. You can see that 22 African countries are in debt distress. We don't really know that much about China. We know more about the situation with the IMF. But so there is because of geopolitics, there is no coordination between the creditors. And the G20 hasn't really taken this up systematically in a way that they should. We have the UN processes, and to some extent, they all come at the wrong time. When when we suggested in 2019, meet again in 2023, it seemed so far away. Now, in a very difficult geopolitical situation, we have 3 important processes, and as I said, the pandemic summit is being used to get issues through, like a Global Health Threats Council that has not flown in Geneva. So we have a new kind of competition again between New York and Geneva that can be very counterproductive to global health. At the same time, if we talk about financing and money, we are not strong enough in addressing the commercial determinants of health. The Director General has just started that work, and we will need, both in terms of climate and in terms of health, a new way of approaching the big major actors and making them socially responsible. And that, of course, is the key in terms of the COP28 debate, where for the first time we have an opportunity to have a whole health day to take things forward. But we also have other treaties we need to be aware of. Really, really important is the plastic treaty that is just being organized. So in a funny way, when people talk about the crisis of multilateralism and you see all that negotiation going on, you sort of say, well, somehow people want to use that system. But what I think is really important, and I hope we talk about this afterwards as I draw to a close, is when you look at the global health debate, one of these things has been we need the really important people to be involved in global health. And the really important people were defined as heads of state. And that's why we need to go to New York. And that's why we, have to have a Global Health Threats Council. I am not of that opinion. I am of the opinion that actually the really important people are, for example, parliamentarians. And our colleague from Unite, Ricardo Leite, told us when he sat in a meeting like this with parliamentarians, and he asked, you might have been there and seen that as well, Mr. Ullmann, that he said, who knows about the treaty negotiations in Geneva? Those are the people that have to ratify that treaty, and nobody knew about it. So I think, the focus, if we want good pandemic action, if we want action on universal health coverage, is to really reach out to the parliamentarians, reach out to countries, reach out to civil society in quite a new way, differently than we have done, than to expect, the solution to come from heads of state that actually failed us quite considerably during the pandemic. I don't have time to talk about the regional processes, but they are also incredibly important. Everything that's happening in Africa around the new African public health order, hopefully the impact of the European health strategy, and hopefully a lot of other regional processes that, of course, are very important in relation to innovation and supply chains. And I'll end with saying that in this whole everything, everywhere, all at once, what does get lost at times is the World Health Organization, which is why I feel, point one, it was very important to hear the minister indicating how important WHO is for German global health policy. But I think we also all need to revisit what it means to have WHO in the center according to its constitution, and what WHO means if it is to be future-proof. What kind of WHO do we need in the 21st century? Not so much, this talk, oh, let's reform WHO, but really, how do we have an organization that's agile and innovative, that can work in digital governance, that has increased treaty power, that really is a voice for the most vulnerable, and that really has the strength and the independence to uphold rights and justice and to hold its own member states accountable. So let's try and get ready for the future. Thank you.
Tina Rudolph is a physician and a medical ethicist. She's part of the Parliamentary Health Committee and as well as a subcommittee on global health. And in this capacity, she is the spokesperson for global health of the Social Democratic Party in parliamentary fraction and parliamentary delegate to the steering committee of the Global Health of Germany. This is where we work together. And her key interests relate to shaping healthcare systems in a way to ensure ecological sustainability, decent working conditions, and the best possible healthcare for everyone worldwide, particularly in the context of One Health. It's great that you can be with us. And Professor Dr. Andrew Ullmann is physician by training. He's member of the Health Committee and serves as the spokesperson on health of the Free Democratic Party parliamentary group. And Professor Ullmann is also the chair of the subcommittee on global health at the German Bundestag and the regional chair for Western and Central Europe of the Global Parliamentarian Network Unite that we just heard about. And Mr. Ullmann holds a full professorship of infectious diseases at the Julius Maximilian University of Würzburg, and where he's also elected to the City Council. Yes, great to have you. Thanks for taking the time. We will have also the opportunity for questions from the audience. You can post, just seeing them, there are already some coming in, but of course also the audience will have the opportunity to ask at the end of our discussion some questions directly to the panelists. Professor Kickbusch has provided a great basis for this discussion, many aspects to tackle, and you also alluded on the crucial role of parliamentarians in addressing global health and setting maybe even global health priorities. I would like to first address you, Professor Ullmann. How do you, we've heard about the important role of national parliaments in actively shaping global health, and how do you see yourself in this role, and what possibilities do you have as a member of the German Bundestag to support current global health processes?
Well, first of all, thank you very much for the invitation this evening. It is not night yet, it's still very bright outside. But I think we mostly underestimate the power of parliamentarians. And one thing which happened here in Germany 6 years ago, we had a subcommittee on global health. Mm-hmm. It was a small committee within the Committee of Health, and now we have strengthened this. We have doubled our resources for economical cooperation from that other committee. It's still a subcommittee, because by the German law, if you want to have a full committee, you need a ministry that mirrors this committee, and so we do not have this as of yet, but the subcommittee has their strengths. First of all, that we could bring in the theme, the topic of global health, which is not everywhere really in the brains of every parliamentarian. As you said before, Professor Kickbusch, when you talk about Baptiste Leite, Ricardo, sorry, he says when you ask this question, hardly anybody would put up a hand. And our job as a parliamentarian is very clear. We could bring in resolutions. We have power of attorney about the budget, how the budget works. We have division of power, which is as very important as the legislation group, that we see what the executive branch of our parliament or our government is doing. This is a check and balances as well. So there are a lot of things that could be done, and one thing I'm very proud of is the resolution that we passed through the subcommittee all the way through with the debate in the Deutsche Bundestag on the 75 years of the WHO. So there are a lot of things that could be done, and now the Portuguese parliament follows our roots with a subcommittee. I think France is now on track as well. So there's a domino effect happening here.
Yes, the subcommittee on global health as a blueprint for other countries. I think that's very nice. And actually, I would like to slip in the global health of Germany as a part of that blueprint that also should be covered in other countries. Yes, Bettina, Rudolph, we just already heard about the proposal of the German Bundestag regarding the reform of WHO. We said it's not necessarily a reform, maybe it's a new interpretation of WHO. Could you elaborate a little bit more on what you would like to see changed or reformed in the World Health Organization?
Yes, of course, and it's very great to be here, and it was very great that we had the opportunity to also celebrate the 75th anniversary of the WHO in the German Bundestag with a debate. And during the debate, we highlighted that what we wished for the WHO would be that the financing of the global health architecture through the WHO becomes more predictable and reliable in the future. Because I think what was said here before also highlighted that this was one of the core reasons why we were not able to tackle the pandemic together worldwide in a decent amount of time. Because we had a lack in the financing of health structures. And we also we're not at the point where we wanted to be when it comes to sharing the scientific results and when it comes to sharing all the goods which are needed to fight a pandemic. And I think what we are still trying to do globally is regaining the trust in those processes. And I think the WHO is the organization which has to do the processes which are needed, like negotiating and like coordinating the Pandemic Preparedness Treaty. And I think if we expect the WHO to play a key role in global health, and if we want to challenge the fragmentation, and when we want to come to a global health architecture which is strong and where all the member states feel really represented, and not just represented when they pay a decent amount of money, but represented because they're part of the international community, then I think this is the way we have to go. And now I come back to the debate in the Bundestag, which you asked about. We highlighted the decision which gladfully was made that the core budget of the WHO has to increase to 50% by 2030. And it is one step which was taken under the WHR to make this decision, but it is another step that every member state has to really rise the contributions to the core budget during the next years. And I think therefore the work is not over. We as Germany, we have to give a good example on that, but we also have to make sure that all other countries are willing and that they can justify for their societies why this is so inevitably and necessary that you can rely on a good financing of the global health architecture. And maybe one point I want to oppose a little bit of what you said, because I'm not quite sure whether the number of parliamentarians who would be able to at least recall that there's a pandemic treaty in a negotiation process has not risen. On the one hand, like Andrew Ullmann said, it's our role. It's our role to make sure that not just a handful of global health nerds in the German parliaments, which we both are clearly part of that group, but actually also the opponents in society did us a favor, because all our colleagues are getting emails and are getting questions, and we cannot deny that in the public debate there's some kind of skepticism against the WHO, against the Pandemic Preparedness Treaty. And I think therefore it was also good to have the debate, and it's good to have debates in the future, because I'm quite sure that all the criticism which is set into prejudice against the WHO in the process can be tackled, and it's our challenge and our duty to do that, and I think we are on a good way.
So that's a crucial role of you in the subcommittee, for sure, to advocate for global health among the parliamentarians, but then also interesting to advocate for the support, for example, for WHO with other parliamentarians, even in other countries, to expand that network. It's great you're taking the task on. Professor Kickbusch, since you also spoke about the important role of parliamentarians, what do you know, maybe also from Germany, but also from other countries, about successful examples where parliamentarians have driven the support and also the change that is needed for global health? And maybe, what can parliamentarians do, but maybe where are also the limitations that we need, again, other stakeholders to take on?
Well, I think okay. Well, first of all, I think we've had these excellent examples. If you say, what can parliamentarians do? What, of course, is really important, if there is a home for global health within Parliament, that it's not just, individual parliamentarians or it becomes a pure party issue, but that, through the kind of committee structure, it becomes something different. And I think that is absolutely critical, and that is why I'm also so happy that organizations like Unite want to use the German example now, hopefully the Portuguese example, etc., to take it forward. There are some other examples. There are groups of parliamentarians in the House of Lords, for example, in the UK. That was actually an example we looked at when we suggested a committee in the German Parliament, and Sir Nigel Crisp gave us very good advice at that time when we were working on the global health strategy. But there's also other things, of course, that are so important about parliaments, and that is, if there is a global health strategy or whatever there might be in a country, that the government is accountable. And therefore, also when we wrote the advisory board report to the German government, we said, the evaluation of the global health strategy of the German government should go to the German parliament through the committee for its evaluation and lead to a discussion of the whole of parliament. I think one thing we didn't expect is what you alluded to, is that because of COVID, there are parliamentarians and strong voices also in the political environment. I was, on Twitter traveling to the meeting here to see what's happening in the INB. And then I get, all this other stuff about, we're all giving up our sovereignty and WHO wants to rule us all. And, quite strong statements. And they are starting to creep into Parliament. And depending what kind of parties are in Parliament, they will gain more voice. And therefore, it becomes really important how we can keep parliamentarians that are in support of WHO well informed, that they know exactly what is happening, that they also have support in the way they will argue, and that they can support each other. If I can say, you know, when we were negotiating the Framework Convention on Tobacco Control, countries were informing each other. These are our arguments. These are our counter-arguments to the tobacco industry, etc. I think in terms of the treaty, we need to set up an organized process like this, that we have a set of arguments that parliamentarians in favor of the treaty, for example, can use in the face of this kind of opposition.
Yeah, I agree very much, and I assume that might make your everyday life a little bit easier sometimes. Let's take this forward.
But
yeah.
maybe I would like to allude on this a little bit, because I think it's really shocking. 2 points. First of all, the COVID pandemic, we thought lessons learned, and we are in a very slow process, even within our own government. We are not prepared well enough for our next pandemic situation, whatever virus or bacteria, fungi, whatsoever could occur. That's the first point. The second point is, through the COVID crisis, there might have been good decisions and also bad decisions made. We did not really fight against the fake news pandemic that is out there as well. And this is now spilling over in the discussion of the strengthening of the WHO, where it's hard to believe, even within, I would say, academics, usually the right wings, to point it to somebody, have their doubts what the WHO can do or what it should not do, or what this really means for sovereignty of a country. All this debates is really weird, and it is more than a very fictionary situation. And the question is, how do we not guarantee, what is the antidote within each country? Every country has to have their own antidote against it, to really explain why this kind of fake news is winning on grounds. And I think it's really clear here that health is something very important, and that infections could be deadly. And a lot of people put this in question for the SARS-CoV-2 virus, which is somehow surprising, despite the data out there. And I think we have to have some kind of a better communication strategy for the future and for today, how to counteract this kind of false information that is put into the internet, YouTube, wherever. And I think that's all our responsibility, not only the responsibility of parliamentarians, but a society responsibility.
I agree very much. I think this is also the group of people, the right community, that is very much interested in supporting evidence-based, but also just simply correct information and then there are different target audiences that we should have in mind. I'm trying to see a little the questions here, but I'll give you one more, Professor Ullmann, with regards to the current, we've heard about the pandemic fund being initiated, but then heavily underfunded. What is your response as chair also of the subcommittee with regards to how can the parliamentarians help to ensure that initiatives launched in the process of lessons learned after the COVID-19 pandemic, that they are sustainably funded and actually implemented?
Well, this is a very complex question, of course, which cannot just be easily answered and say, okay, no problem, we'll put it to the budget, a couple of million euros more, and then everything's going to be fine. I think it has to be really clear, and I think Professor Kickbusch mentioned this already, the fragmentation that we're facing. New ideas, new funds, inside, outside the WHO, all these points have to be addressed, and a new fund doesn't really mean new money. It's maybe just redirecting the money into a direction where it's needed. And this is then the responsibility, of course, not only of the financial ministry and the chancellery in Germany, it's also the responsibility of us parliamentarians to see, is this that we do agree on, and how do we bring in this more sustainable financial situation into the world? And I think this is very challenging, especially today where we are facing a lot of constraints with our budget. It's not only in our country, it's in many countries, the situation. So I think putting it down, we need to focus where we want to set prioritizations. And it is not new money, it's just going to be redirecting of the money.
Yeah, I think you can take an example for that. In some quarters, Germany was criticized because it did not give enough money to certain disease categories. On the other hand, Germany was the only country that gave money to the WHO contingency fund. And that shows the difference of approach in terms of what you decide to fund. If that money hadn't been there in the contingency fund, I'm not even talking about COVID now, but other outbreaks along the way, the situation would have been very dire. And therefore, rather than create, in this case, a pandemic fund, a proper analysis of what does the WHO, WHE program, that's only 10 years old. What does it deliver? How has the contingency fund worked? How have the monies flown? And would there not, be a mechanism that would actually strengthen an existing infrastructure? But if the interest, of course, is, and I return back to, that to the hegemonic regimes, that if you don't want a certain structure to be stronger than it presently is, because it is an inclusive structure, and you prefer to have a structure at the World Bank over which you have, more decision-making power, then this is what you get. And I think these are the very irresponsible behaviors that are not, as Mariana would say, mission-driven, and that in the end, do not help actually either in terms of responding adequately to the pandemic, nor do they help because they actually weaken WHO. And if you just think, just very pragmatically, of all the negotiation time that was spent in negotiating this pandemic fund, I just wish, that time had been spent more productively, really. And that's the other thing, if you look at this, 10, 12 negotiations going on at the same time. What actually is it that we gain from that in terms of really a progress towards health for all and a reduction of inequities in the world? And at present, it really doesn't look good. I hate being so sort of negative for a minute, but I think we're not putting our resources where they can be best used.
And maybe this is the role also again of the parliamentarians in this kind of watching where the resources and the time spent and kind of in that accountability function, guiding a little bit as far as possible the decisions also of the government. I'll look. Do you want to react? No. I'll look into the questions here, and then you can also raise, and then someone will come, your hand, and someone will come with a microphone. I'll first take that one, and I'll direct it to Tina Rudolph, if this is okay. Isn't global health shooting itself in the foot by having 3 high-level meetings at the UN General Assembly this year? What's the point, really? Do you have an opinion?
Actually, I was hoping for the second question, but I can also take this one.
Take both.
When I looked at the topics of the meetings, I actually can understand why we need all 3 of them. I think tuberculosis is a far overlooked challenge to the international societies, and I also think that universal health coverage, and I'm very proud and I'm very happy that universal health coverage has made its way back on the table of negotiations in the global health debate. So I can understand the criticism in this, and I can also understand the criticism in how the global health landscape is structured, what you mentioned, that people are just jetting from one meeting to another meeting, and that sometimes, we are talking about the climate change, and then you have to ask, but why are so many people entering a plane just to go to the next meeting, and why are we not using the online opportunities far more? But actually, if I'm pretty honest, I think it's good that we have all the 3 meetings, because I don't want to cut short on any of the 3 topics. I'm just taking the liberty of just going to the second question, which is about the possibilities of internalizing external effects of what we are doing, of what politics is doing. And I think we have some good starts to tackle this debate and this question. I think what the core problem is when you want to internalize effects is that you have to make these effects measurable, and this is I think if I can do this, this is what I truly want to ask for your help, because I think this is a field where good and sufficient ideas are still lacking. For example, when it comes to the debate, how can we make it visible how many of carbon dioxide is actually internalized in products, is actually internalized in our processes, what we are doing in the healthcare sector. A very real way of challenging that is that we are still negotiating and thinking about the concept of including sustainability in the social law of Germany, and to make it possible that these effects are measured and that we can count these effects. But when we want to broaden the horizon to the mere concept of responsibility, like which was already mentioned, that the broader and not so narrow view that Germany is accountable, and maybe states of the global north are somehow accountable more than others for the effects of climate change, and therefore we have the responsibility to act, and this is concluding into funds, which what we are currently doing is to set up funds which will make it easier for countries suffering from the climate change to lower their burden. For example, in giving money into projects to strengthen their resilience. But we all know this money is not sufficient, and I think one way to make it sufficient, one way to tackle what is meant in the question is to make it measurable, like to make it possible to really create an accountability relying on facts, and therefore, I think it's a tough question, and I think we can all, and I think we all must work. We have to work together when we want to tackle that.
It's challenging, and I think probably it's many different people with different expertise to actually come up with these accountability mechanisms that make the investments and the benefits measurable.
Can I just
sure.
say, it is incredibly difficult, and of course that is what WHO has grappled with since its day one. Mm-hmm. How you measure the success of normative processes. And one of the greatest challenges we have right now is the digital transformation. And if you want WHO to be stronger in terms of digital governance, in terms of digital health, in terms of all the issues around artificial intelligence and medicine and whatever, this is not something you're going to measure within 2.5 years. These are, very deep societal processes. These are, governance mechanisms. Probably you even have to think of yet another treaty. Dare we do that? But I think that's really the problem. There is the enticement that in health you can measure the reduction of disease. And you can, measure that malaria has gone down, or AIDS, or I don't know what not. But to actually measure the success of normative process, that is something that we really need to work on. It's not impossible because, political science does its job as well. And we're just embarking also with Professor Ullmann's issue of the measurement of trust development in society. And WHO is starting a very important initiative here. But still, I think we have to think and analyze the kind of measures we want to see and the kind of measures we want to adapt. And in health, we rapidly fall back into the old stuff. And here we have to be more creative.
Yeah, but actually, we do have the Sustainable Development Goals, and I want to come back what you just said, that when you rightfully demanded that the global health strategy has to be evaluated and that there's responsibility in just looking at where have we been able to follow our principles. And I totally agree with what Professor Mazzucato said, that we have to be goal-driven when it comes to global health, that we need a program like when we want to go to the moon. We need to make sure that a lot of professions are working together and that health and global health and public health is not just merely a task for physicians. And I mean, we so much suffered from a lack of psychologists and people who were able to communicate what politics was doing during the pandemic. And so I'm really glad that there is a passage, or at least I think there still is a passage about this issue in the draft of the pandemic treaty, that it's a responsibility of all member states to make sure that health education is an issue, and that that people have to be and have to feel educated so that they are able to understand what's going on in health, what's going on when the politicians decide this or that way and how it is justified. And I think, it's a real challenge, but I think, we have to broaden the team which is working on that.
Rightly said. I know we're running late, but I want to keep my promise and give the audience the possibility to ask 2 questions. There was one very early here, and then I have the gender balance. Actually, I need a lady. Oh my God. Where are the ladies? Okay, then I'll...
Okay.
One here and then... Oh, there.
My name is Mustafa Hunter, founder president of Health Governance International, and what I would like to say at this point is that we have this collective responsibility also around that good governance delivers good health, because there is a bit of skepticism around that. And it's underfunded, and you just highlighted this point that we more think around putting money, we want to just, what I hear always like justify it to taxpayers that we treated this disease. It's easier than saying, okay, we helped in transforming this system that would take 10 years, and how we would build the business case for good corporate governance and good governance, accountability and architecture, and how the German example that's a bit underrepresented in so many different country institutional architecture could be presented also in the global architecture example.
Can I ask a question? To that question, do you mean with the architecture, you mean the German system of health insurance?
Not only what's presented is the German health insurance, but you don't present so much, for example, the German system in corporatizing public hospitals and creating the GmbH system, or the university hospitals belonging to universities or others, how you balance the structures, the state versus the national. There's so many examples in the accountability public-driven but corporate eco-social market economy. We always present the Bismarck side, which is everyone knows, but I believe I know Germany well. Lots of examples here could be shared also in this sense. The mechanics of the system. Clear or
challenging?
We can discuss it later again.
That's also a good idea. One more question, and then you'll have the opportunity to reply. Yep, Professor Krüger. And then...
Only a short comment about the perceived role of the Global Health Hub. I think after listening to colleagues here during the whole morning, that there's much more expertise and knowledge about global health in the country than it ever comes to the parliamentarians. And if you ask, how do we channel what we have studied and what we have found out, they say go either to to the Robert Koch Institute or to Ilona Kickbusch. And I think this could be an important role of the Global Health Hub, to be more a communicator between say the research community or intervention community and the policy makers. Thank you.
Thank you for that comment, and a role that we're happy to take on. And it's good we have one communication channel on the stage already. Okay, I'll give you the last possibility to reply, and I think that's why we're having the reception. We have a lot of opportunity to talk, exchange, continue the discussion from here. But first, I'll let you answer.
Yeah, when it comes to the second question, I think I'm a little bit biased because I'm myself part of the steering committee, so I know the Global Health Hub quite well, and I'm looking forward to every policy paper which is produced, and I can just emphasize that you all go on and highlight us and enlighten us with whatever you are participating in these policy papers. And I'm really glad not to see the room full of enthusiasts about global health, but also knowing that so many people are participating in the communities and and doing this mainly in their free time, and I think it is a thing we can be proud of here. And I wish this work to continue. And when it comes to the function of the linking, then of course knowing that the Global Health Hub exists and is producing policy briefs, it's good for us to know as parliamentarians to rely on these policy briefs, even if I have to make this. Yeah, I think it's obvious that we cannot just adapt a policy paper fully in German politics. It's not how it works, but it's an inspiration, and it's good argumentation. And I'm really grateful for that, and I just wish this work to continue. And the first question, when it comes to the German example and the question how we can help to build health structures in other countries. I think when we are asked, and by we I mean the BMZ and the GIZ, then they are willing to share, and I think it's a good sign that, as far as I know, more and more governments internationally are asking for that kind of help. And they are making health a priority when it comes to the intergovernmental negotiation, and when it comes to decide for what topics should be a part of the intergovernmental and the international cooperation. So I think this is a good sign, and I think it's always good to have the example and that we are asked about. And yeah, I wish that we can have a fruitful debate. But it, on the other hand, always means that we also should be open to learn from the others, because I think when it comes to digitalization, for example, unfortunately, we are not the key role player anymore when we ever have been. I'm not sure about that, but actually, I think it's maybe it's a good sign, and maybe it's a good strategy to make it more mutual. And always to highlight what that always there's also a benefit for us, and that I've seen so many great projects internationally that I also got good inspirations from, and so but I think we will continue.
Do you have some final remarks?
Tina said so many things, and I would say, especially the last one, digitalization, I totally agree, but we have wonderful startups here in Germany that do know how to do this, but we have to still learn as policymakers how we implement this into our system. That said, it's nice to hear that you're so optimistic about the German healthcare system. I would say this is work in progress and will be always work in progress, and we have imbalances. We have a very expensive system. It's not very effective in many areas. There are a lot of things that we're debating right now here in Germany, how to make our system better. That's why I think it's also to understand it is not a bad system, but we could do better, and we could, I would say, make it more cost effective. And then this could be also a very nice thing to propagate for other countries. Nevertheless, I'm pretty sure other countries out there have also very good systems, and they have to make it doable for their countries. And I think that's very important. I wouldn't agree to say the German system should be everywhere. I think we're not that good, and we shouldn't go that direction. The other point is Global Health Hub. I totally agree. I had the same feeling. When I started off with Global Health 5 years ago, I was actually triggered by a very special attending, Paul Farmer, in Harvard over 25 years ago. He was my attending when I was working in Boston. And I was so glad meeting you, Professor Kickbusch, how complex this whole story is. Sometimes I thought it was very easy, and I realized on my side it was very naive the way I was thinking. But especially the Global Health Hub was an eye-opener for me to see how cooperations are possible, how research is done here in Germany for the greater good, for international support. And this is a wonderful platform which we have reports on a regular basis within our subcommittee, and those meetings are then publicly opened. This is not in every committee in the Bundestag, so then you could see those reports either live or in the media that we could see what we talked about, where we want to go to this direction. And I think this is very important to make our world not only a healthier but a safer place, to empower people for health, to make healthcare systems stronger. I think this is a very strong issue, and that the policymakers understand the importance of global health architectures and global health politics per se, and what we as policymakers have to keep in mind, we have to keep the pandemic in the past that we just went through should not slip our minds. It is not the last pandemic on influenza 100 years ago. It was just recently, a couple of weeks back, where we were facing a devastating pandemic worldwide. And this lessons learned, I would like to shout out very loudly to this world that we should not forget this and work on those issues again and again. And I think those meetings as today are very helpful to this issue. And thank you very much for all of you working in these fields.
Thank you. Do you want to do quick final remarks? Perfect. Thanks.
No, I just want to say, since I've been involved in global health for quite some time, and when I first came back from the United States, there was no global health community in Germany. And if we see what has developed over the last 10 years, partly supported by structures like the Hub, now, also with GLORA, structures like the World Health Summit, etc., that we can say, yes, there is a global health community. There's not yet a strong enough academic health community, I think. We could still do much more funding in terms of global health research and innovative contributions. But I do think if you look at these various structures that have developed, something really valuable has emerged that all of us who've contributed to it can really be proud of, and that it's not just outside of government and parliament, but that it's inside of government and parliament as well. And I think very few countries have that mix. And really analyzing that mix itself academically could be a really interesting feature. The last thing I want to say is that we do have a global health strategy that sort of disappeared into the mists of the pandemic somehow. But that strategy is till 25, and 25 is around the corner. So I think, the global health community in Germany should start thinking, does it want a new strategy? What should it look like? Who should be involved in writing it? And how should it be taken forward? So I think that really is an important next step. And the third strategy then that Germany has, I hope, could be built on a much broader base than any of the other two have been able to have and to use. And I think that's a wonderful thought to have. Thank you.
Thank you very much. Actually, the steering committee of the hub is already planning to put their heads together about the review of the global health strategy and to come up with some suggestions to the government. Thank you very much. I'm also taking that point with regards to the expertise shared by the hub, and I think it's actually beyond policy papers, because we have also the members. We don't have policy papers on all the topics the members are working, but we can use the members also as experts and directly put them in contact whenever useful, also with the subcommittee and other parliamentarians to actually access that expertise that Professor Krüger mentioned. Thank you very much for the lively debate. I'm sure there's a lot of ideas, food for thoughts, threads to continue discussing in the reception. I would like you all to invite you all, also the audience online, to come back tomorrow. We have a second day full of interesting sessions starting tomorrow at 9:30. We'll have an opening speech on global health, a session on global health financing with a parliamentary secretary of the Ministry for Economic Cooperation and Development. An interesting panel. We'll launch the policy paper of the hub on global health financing. As I said, we'll have the climate health session with a TED Talk by Professor Rockström from the Potsdam Institute for Climate Impact Research, an interactive simulation exercise on heat preparedness, and also an international debate on urban health as one of the topics of the hub communities. Be back, and you'll of course have also the possibility to ask questions. Thank you again. Enjoy the reception and see you tomorrow.